Hi, are you having difficulty falling asleep or staying asleep because your hips hurt? If you're having hip pain that causes insomnia, I made this video for you. I'm Dr. Hamilton Stubbs. I'm a board-certified sleep specialist and I'm trained in nutrition. Hip pain is a common reason for insomnia. It's probably one of the joints that gives us a lot of pain when we look at all of our joints. That's because it's a weight-bearing joint. Over time, the hip joint can deteriorate and develop what's called osteoarthritis. When an x-ray is taken, your health provider may tell you that the bones are actually rubbing up against each other, and this causes irritation of the nerve and a lot of hip pain. But when you go to sleep at night, that pain could be due not just to the arthritis, but to weakened muscles. Inflammation around the joint will weaken your muscles. And with weak muscles, when you go to sleep, gravity can take over and pull your hip out of alignment. This could be the cause for your hip pain during sleep. So what are you going to do? You want to decrease inflammation. One of the key things for decreasing inflammation is not just limited to the prescription medicine that your physician may have prescribed or your nurse practitioner or PA, but it's at the grocery store. What are you eating? There are certain foods that are associated with inflammation. These would be your refined carbohydrates, hydrogenated oils, your margarine, and really sugary drinks. I'm going to leave a link below to a Harvard website that gives you a list of the inflammatory causing foods. The other thing you want to do is eat foods that are good for your joints, and these are going to be your vegetables. Green leafy vegetables are one of the most nutritious vegetables for your connective tissue. They're full of vitamins and nutrients and minerals that help the joints. In addition to your diet, you want to do some exercise. The exercise is to strengthen the muscles that hold the joint in place. There's two types that you want to do. You want to do muscle building and you want to do stretching exercises. So the muscle building exercises, I like to do squats, and you can start with just sitting in a chair and try to stand up without using your hands. When your muscles are weak, people tend to use their hands to push off from the chair and help them stand. The other one I like to do is something I call a Kaepernick. Yes, Colin Kaepernick. You know, the guy who took a knee. Take a knee yourself. Just put one knee down on the floor and keep the other knee at a 90-degree angle, parallel to the floor, and then try to stand up. Do that a few times on each leg every day, and that's going to help strengthen up your legs, your muscles. The other thing you can do is a Murphy. Now, Murphy is something that you may have to work yourself up to because it's a series of exercises that calls for pull-ups, squats, and running. The Murphy is a great CrossFit exercise that was developed and named in honor of the late military officer Murphy. He was in the Navy. I'll leave the link below so you can get the instructions on how to do a Murphy correctly. When you go to sleep at night, if you're going to sleep on your back, you want to put pillows underneath your legs to keep your legs in alignment, not just the hip, but the lower leg. You don't put it right under the knee, but you put it under the lower extremity where it supports the knee. The other thing you might find that helps sleeping on the back more comfortable is to put a small pillow or a rolled up towel underneath the small of your back. And this will give your back some support because as you go to sleep, your muscles will relax and gravity can take over and it can pull your muscles and your joints into positions that aren't so comfortable. A small pillow under the neck is also helpful. When you sleep on your side, you can use your pillows again, but in a different way. Sleeping on your side, you put the pillow between your legs to elevate the upper leg so that the leg is in alignment with the hip. You might also want a small pillow to go underneath your shoulder to keep your hip in alignment, and a small pillow underneath your neck. Those things ought to help you. diet, exercise, and your sleep position. Always talk with your doctor so you'll be sure of what is causing your hip pain, because there are conditions that have nothing to do with the hip that is causing the hip to have pain. It's called referred pain, and there are some things that are a lot more serious than osteoarthritis and might need immediate care. So self-diagnosis is not recommended. Get a professional, a qualified health provider to diagnose why you have hip pain. And they may also be able to help you develop some strategies for how to eliminate the eliminate your hip pain. You can always tell them about the things you learned here. If you like this video and you learned something, give me a thumbs up. And don't forget to share. Don't forget to subscribe if you haven't already. I love having you, and thanks for watching.